and welcome to our live stream at Duke Spine. We are going to be performing a disc repair on a patient who has, can you get the wag a little bit better? Just a tiny bit. He's got basically bad discs at 4-5 and 3-4. Herniated. Shot. And he's traveled here. Texas. No, it's not Texas. Brendez, you're funny. Sean? From Annapolis, I thought. Shot. AP. Yeah, AP. Annapolis, right? You're doing great. Lay still. Okay. Lateral. Num. Gonna give you a little more numbing medicine. You're okay. You're doing great. We're just getting to where we need to go. Shot. Shot. All right, so the first step of the surgery is to literally access the herniation with a needle. We have to guide the needle down to where the herniation is. And this patient has had back surgery before. Wasn't done here. All right, let's go AP. Knife. Watch your hand. Perfect. Let's go back to a lateral view. Are you comfy? We're almost done. We're going to put you to sleep in just a minute. Shot. 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 You feel that? Where? Shot. In your back or down your leg? A lot of arthritis there. Incredible. That's where he had his prior surgery. I'm almost ready. Where do you feel that? In your back? Shot. That's your facet joint. You're fine. Just lay still. We're almost done. Almost done. Shot. 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 Wow. Are you comfortable? All right. He said, yes, sir. Very polite. It's Dr. Duke Machen here. We're going to put you to sleep in a minute, but I want to do something real quick. You've watched a few of these surgeries, haven't you? All right. Can you hear what he has to say real quick? Yeah. So we know that he has a herniation and tear at 3-4 and L4-5, annular tear, herniation. Are you having any pain right now? All right, good. You're comfortable? All right. How bad is that on a scale of 1 to 10? 9? Is that where you typically get back pain? Good. That's one of the discs we're fixing. That's great news. Is it better now? You ready to go to sleep? How bad is that on a scale of 1 to 10? 9 or 10? Is that where you get back pain? When you wake up, your surgery will be done. You get to go to sleep now. Count out loud for us, 1 to 100. All right. So, for those of you watching, we just tested both discs that I thought were causing his back pain. And indeed, both are. One of them is a 10 out of 10. The other one a 9 out of 10. Both concordant. All right. Shot? Shot? We had 4 or 5, right? Shot? Uh-huh. At this point, we've accessed the discs right through the tear. We're not actually operating on the disc, folks. We're operating on the tear in the back of the disc called the annular tear. This is not a discectomy procedure. It's not a laminectomy procedure. It's a procedure where we go in and clean out the tear in the back of the disc. There's no surgery quite like it. It is disc surgery because the disc is the problem. But it's not the kind of disc surgery that maybe you've heard about before. Shot? It's called the Duke laser disc repair. It was developed at Duke Spine. We've peer-reviewed and published it. Shot? And now we're performing it. This patient has had multiple surgeries in the past by another surgeon nearby on the other side of the state. And he's still in a lot of pain from that. Push down. So he decided to look us up and come to Florida and get his back fixed. Is that it? Shot? And here he is. So he had a procedure done in Hudson, Florida. If you look up Spine Clinic, Hudson, Florida, you'll know who I'm talking about. I won't mention any names. But didn't help. Made him worse. As a matter of fact, he got a spinal fluid leak from that surgery. Not happy about it because the surgeon never told him he had a spinal fluid leak. Yes, no, maybe so. Yeah. Good job. All right. At this point, we have performed our discograms. We've accessed the disc. We've lost about 5 cc's of blood, not too much. 5 milliliters is about 5 times 20, 100 drops. And we're ready to start our first laser disc repair. Any questions from the audience?
No questions.
Wonderful. So why don't you show the audience how a herniated disc in the back can actually cause so much pain. These patients suffer so much.
Copy that.
Inflammation comes from the tear in the back wall of the disc. What causes the inflammation is the herniation within the tear. I was just talking to Sanjay about how the inflammation you could see on these videos, how it causes not just pain in the back leg, but also it causes scar tissue to form in the back of the disc. He's doing a lot better, isn't he? He made his face comfortable and he's happy. All right. Well, our first patients from today are already gone, and this is outpatient surgery. I think we're a bit overexposed. I think if we could turn down the light just a little bit. Yeah. Yeah, perfect. Whoops. Look at that granulation tissue. See the pink stuff, Sanjay? Oh, it's
Yes,
beautiful. Folks, that's granulation tissue. That's where all of his back pain's been coming from all these years. And the other procedures he's had, the laminectomy, microdiscectomy, foraminotomy, MBBs, none of that is going to take that granulation tissue away. And until that pink stuff goes bye-bye, the patient still has back pain. So we just got rid of it. He's going to feel like a new man. Chronic back pain is so bad. It really hurts people's lives, destroys them, keeps them from being active. Many people can't even go to work with chronic back pain. So they have to modify their schedule, modify their life. Unfortunately, some people even get put on powerful drugs called narcotic opioid painkillers. And those drugs, they're very addicting. If you don't know what I'm talking about, there's a program on Netflix right now. It's called Painkiller. It's a docuseries. And it's about, Yeah, it's about the companies that produce these painkillers and how they're so profitable, how they really did everything they could to sell painkillers, which, by the way, there's some good to that. The good is that, number one, they started recognizing chronic pain as being something important to treat. That was good. But it's how they treated it that wasn't so good. And in their defense, and I would never really defend a company like that, that's a legal drug dealer, they did try to help people in pain, but they failed to recognize those drugs were hurting people. And that's really important. If you're going to treat somebody in pain with a treatment, you got to make sure the treatment's not harming them. You know, first do no harm. That's our motto as doctors. First do no harm. So we want to help people with treatments, but we don't want the treatment to actually backfire and cause more problems for people. So in the end, this treatment you're watching right now was the right treatment for all those people with back pain that ended up getting put on narcotics, opioids, by their doctors, and then, of course, become addicted. Now, Berndes, there is another Netflix documentary you may be interested in. You know what it is? It's called The Pharmacist. Got to watch that one next. All right, we're just about done with this disc here. And this is 4-5, Luis, correct? Yes, we're going to go next to 3-4, and then we'll flip over to the other side and do 4-5. So far, everything's going well. Our patient is comfortable. Just want to make sure I get all the painful tissue. Like that right there. He is not happy about that. Yeah, just about done. Lay still, everything's okay. Woo-wee. That's granulation tissue just coming right out of the back of the disc. Let me know when you're ready. Look at that. Poor guy. This whole area is inflamed, by the way. You all see that? They're all pink everywhere.
Yes, we do.
A lot of inflammatory tissue. But we got rid of the herniation and it looks good. That thing should heal up nice. All right, we're done here.
Nice one, please. Thank you.
One down, two more to go. Patient's doing well. You could see at the end there when I got close to all that inflammatory tissue, he was not happy. He started to really feel the laser working away at the back of his disc. So any questions, Sanjay?
We have a comment from Mary Hofteling on Facebook.
Yeah. Hi, Mary.
After 33 years of back pain, I was put on gabapentin this week. So the first time, because I don't like pills, I can say that it is helping with my
Is this
Yeah.
medicine?
intracranial brain pressure that I get for my spinal cord and neck injury.
Is this num-num?
Yeah.
All right. Very good. So you're saying that you're getting intracranial pressure increases, I think is what you're saying, if I'm not mistaken.
She mentions that it's helping her. The
Oh.
gabapentin is helping her with her intracranial brain pressure.
Oh, okay. Was there a question, Sanjay, or is it just a comment?
It's a comment.
Got it. Well, I appreciate you sharing. Shot. Okay, we are now heading into the next disc, which is number 3-4. Also very painful for the patient. How are we doing, Berndes? Is he getting what he needs? Great questions and comments. And we've already shown our video, haven't we, Sanjay, of
We
how
have just
the
shown one of our videos. There is just one left out.
we showed the video on how the Duke laser disc repair works.
No, not yet.
Thank you.
Let's do that one.
Okay, copy that.
Show the audience how the surgery actually works. All right, welcome back. So now you see from our video that this inflammation that people get in their disc can actually be treated with the Duke laser disc repair. And the inflammation will actually really go away once you repair the disc. These are all pieces of herniation though, every one of them. You could see the tear right there. It's like a crack. And all the pieces of herniation are just stuck in there. And we use the laser and grabbers to remove them, to clean out the tear. Sanjay, what's the cause of all disc injuries?
It causes herniation?
Trauma.
Oh, you mean
Trauma.
the cause? Okay, it's trauma.
Trauma. Injury. Are disc herniations things you're born with?
No.
No. Is it disc? Well, that's not really born with. That's natal. But disc injuries are traumatic. They require trauma. All disc herniations must have trauma as the first event, the initial event. It's important to understand this. That's not something any people have understood. We've not believed that. We've not known that. As a medical group, a group of medical doctors, doctors think, number one, herniations are just natural part of aging. They're not. They're traumatic. They don't happen normally. They only happen in the setting of trauma. Defining the trauma is difficult. Sometimes people, well, I mean, most of the time it's very old trauma. By the time patients come to us, the trauma was a long time ago. That's kind of like, you know, psychological problems, right? People don't get their psychological problems dealt with a lot of times until they're adults. But the psychological issues began usually in childhood, with childhood trauma. And we recognize psychological injuries from trauma, psychological trauma, physical trauma. But as a group, as doctors, we fail to recognize disc injuries as being traumatic, post-traumatic, but they are. And until we start to recognize disc injuries as being post-traumatic, people are going to have a lot of questions about why do I have this problem? And more importantly, who's responsible for it? All right, we got 5 minutes left on this disc, and we're going to go to the next one. Any questions, Sanjay?
We have a comment from Mary Hofteling on Facebook.
Hi, Mary. Yes.
She says, I need L4, L5 and S1 done on both the sides.
I see. All right. Mary, have we actually done our MRI review with you? I don't remember. But I appreciate your sharing. I have a lot of patients that come to me and say, oh, I need this and this and this. And then it turns out they don't. They actually needed nothing quite like surgery. They needed something else done, like facets. And it's always a blessing in disguise when you find out you don't need the disc surgery, you need a facet surgery. Because the facet surgery is a faster recovery and a less expensive and less invasive option. I was just talking to one of my patients from today, and his mother and I were talking in the recovery area, and she has neck pain. She said, I need you to fix my neck pain, my discs. And I said, let me see, where's your pain? And she pointed right to her facet joints in her neck. And I said, that's not your disc, that's your facet joints. I said, that's very easy to fix. We can do that quickly.
We have a reply from Mary Hofteling on Facebook.
Yes.
She says it was almost 2 years ago we did our MRI in month of February.
Did we do a review together?
She says so.
Oh, okay. She did an MRI review, or she got an MRI 2 years ago?
I think it's MRI, not the review.
Yeah, she may have an MRI that's 2 years old, but we need to do an MRI review.
I can share the MRI review form with her.
No, don't worry about it. We don't want to check. We don't want to share one patient's information on the internet. Just she'll figure it out. If she wants to do a new MRI review, she can.
Sure.
Happy to do it. We do it for free. All right, we're almost done here. A lot of scar tissue. You can see that's the end of the disc, and there's the end plates. There's some blood vessels in the epidural space. This is the back of the disc right here. I have 1 minute left on this disc. Really good. Very happy with the results. Let's grab in there. Want to make sure I'm not leaving anything. All right.
Lights on, please. Thank you.
You can see all the pieces of herniation that have come out. Where's the... We're going to switch to the other side next. Any questions?
No questions.
His surgery is going very well. Let's switch sides. Watch that. Oh, I'm coming over there.
Oh, okay.
Come over here.
I enjoyed this.
You did good. Shot. You watch the fiber? None, none? Shot. Shot. So this is our third disc, our last disc. See, Luis, I don't discriminate. I hit myself too. Scope out. I got this. All right. This will be our last and disc we're fixing. So far, his surgery is going very well. Oh, look at that granulation tissue.
Thank you.
You guys see it?
Yes,
Right
we do.
inside the tear.
Yes, we
It's
do.
perfect.
Lights off, please.
Laser. So that is why he's been having back pain all these years. Now he also has facet pain. I talked to him about getting it fixed. We may do that in the future. He's going to need his facets treated. His facets, unfortunately, were destroyed by the other surgeon, whose name I shall not mention, but not here at Duke Spine. Grabbert. Less than 10 minutes, probably around 10 minutes max.
Thank you.
Any more questions, Sanjay?
No questions?
So if you're going to stick around for the last case of the day, it's going to be a thoracic Duke laser disc repair for a patient with one-level thoracic herniation. And he's traveling to us from Texas? We got a lot of Texas patients, which is good.
Get a lot of Texas guesses too. It's a big state.
I want to make one more announcement. I said this earlier. We did our second shoulder. Oh, was our second or first? Our first. First shoulder, sorry. Our first shoulder DPR, Duke plasma rhizotomy. This patient has a bad shoulder. She has arthritis, severe. And she was told she needed a replacement of her shoulder by 2 orthopedic surgeons. But she didn't want it, so she came here and to Duke Spine and Duke Joint Institute. She ended up having our Duke plasma rhizotomy procedure yesterday, went home 30 minutes after the procedure, and her shoulder pain is 95% gone, which is incredible. It took us, what, 30 minutes to do the procedure? There's no downtime. We're just about done here, Sarah. Like literally just a few minutes left. No downtime for her shoulder. She has, how many cuts? She had 3 cuts, right?
3 cuts, yes.
3. Each cut is 3 millimeters. Almost no blood loss. And she came back today. We saw her in clinic. Her pain is 95% gone. She is happy as a clam. Honestly, don't know why they say happy as a clam. Is there something about clams I don't know?
They don't get depressed.
They don't get depressed? All right. Any questions?
No questions.
Two minutes. You got the other side wrapped up?
Yes, sir. Yeah.
So what do you think? Yeah? You have any reservations about her?
No, I mean, I know her from over there. She's doing great with the lab. And, I mean, I know she's
She's got a great attitude. She's hardworking.
Yeah.
She's a good team player, I think. Right?
Correct, sir.
Sanjay, we're almost done.
Copy
We
that.
have about a minute left.
We have a last comment from BJ on YouTube.
Sure.
I filled out MRI review form today. I have a ruptured disc in C4. Surgeon wanted to place artificial disc, but I haven't felt comfortable following through.
Yes.
Some days are pretty bad some.
Don't worry, we can fix it without the artificial disc. You don't want that junk in your body.
We have a last question from Sharma Gedon on YouTube. Hey
Hi.
doc, how
Hey
are
there.
you?
I'm well, thank you.
How do you remain cool as cucumber as you perform your surgeries?
Great question. Well, a lot of reasons. Number one, I'm from California. I have that California, easy mentality. Number two, I have literally the best team in the world, and they make my job easy. So it's like if you're Messi and you have the best team, it's easier to score goals. So you got it? I can score goals because I have great support, and I can be cool about it. I think that's it. Number three, I've done so many of these surgeries now. I mean, so many that if you think about it, I've done 1,700. 1,700 is a lot of the same kind of surgery, If you did the same thing 1,700 times, then you're going to be pretty good. And you're going to be pretty cool like a cucumber. And then the next reason is I like cucumbers. I eat them with some salt. If you've never had a cucumber with salt, it's wonderful. If you leave the salt too long, it becomes a pickle. But they're very healthy for you. So I don't mind being cool as a cucumber. Plus, if you panic, it doesn't help, obviously. It makes it worse. And then finally, this surgery is just so wonderful because it's so rare to have any problems, Sure, it can be hard. Some of the patients can make it difficult, their anatomy or whatever. But for the most part, it's a very safe, very easy surgery, as long as you know what you're doing. And I tend to know what I'm doing. I've been trained very well. Let me just say, for a neurosurgeon of my training, this is not that hard of a surgery. This is pretty darn easy. I'm a neurosurgeon trained to take out clip aneurysms, take out brain tumors. He's waking up. Just lay still. I need someone to take this. Come on.
Hey, my friend, try not to move your arms, okay? We're all done here.
Yeah.
Everything's doing great.
Perfect. Great job waking him up, doctor. You got it?
I got it.
And when you're trained, to drive like a Formula One car, and then you get into a Porsche, sorry if you like Porsches, but it's not so hard. So I guess if you've been through the worst there is, and then you experience something that's not so serious, Like if you've been through a hurricane, category 5 many times, 1,700 times, then the storm isn't so bad. Great question though. Any other questions?
We have a last question from Sharma Gedon. How resilient have you found the human body to be in all your experience as a neurosurgeon?
That's a great question. The human body is both fragile and resilient. In many ways, our fragility is more psychological and limits us in our abilities and our potential. I believe humans are capable of far greater feats than we challenge ourselves every day to achieve. And I believe that I've seen just what a human being can do when the humans rise to the challenge, whether it's emotional or psychological or physical. Being a neurosurgeon being trained in the United States at one of the most difficult training programs, I've seen what my colleagues can do and what I can do. And it's far more than I ever imagined. So, but yet at the same time, we're also very fragile. So it's sort of a yin and a yang. All right, well thank you, Sanjay. You can go ahead and end the recording.
Copy
And we'll
that.
be back for one more quick surgery, thoracic.